Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Postpartum Depression. Introduction. The birth of a new baby can be an exciting and stressful time for mothers. New mothers may experience joy, fear, excitement, anxiety, and even depression. Over 50% of new mothers experience a form of mild depression after the birth of their child. This is often called the baby blues and only lasts a few weeks. About 10% of new mothers develop a more intense and longer-lasting condition called postpartum depression. Postpartum depression is a combination of physical and emotional changes that happen to mothers after giving birth. Postpartum depression can be overwhelming, but getting treatment can help. This patient education program discusses postpartum depression, its symptoms, causes, screening, and treatment options. It will also give you some tips on how to cope with postpartum depression. Symptoms and causes. Feeling sad, having mood swings, and feeling irritable are common emotions for new mothers. When this lasts only a few days to a few weeks, it is known as the baby blues. Postpartum depression may seem like the baby blues at first, but when the symptoms don't go away, the number of symptoms you have increases, or your symptoms get more intense, you may have postpartum depression. It is not known exactly what causes postpartum depression. After having a baby, it is thought that chemical levels in a new mother's body called hormones, like estrogen and progesterone, can change a lot and quickly. This quick change can lead to feelings of sadness, anxiety, mood swings, problems with sleep, and many other symptoms. The extra pressure of caring for your new baby and lack of sleep can add to these symptoms. Other factors in your life may also cause postpartum symptoms, like marital issues, family problems, and other stressors. Symptoms of postpartum depression may include feeling sad, feeling bad about yourself or feeling like you are not good enough, feeling guilty, not feeling hungry. Symptoms of postpartum depression also include intense mood swings. For example, you may feel very happy one minute and then very bad the next, having trouble laughing, crying a lot, having a difficult time bonding with your baby. Other signs of postpartum depression include thoughts of harming yourself or your baby, trouble sleeping, feeling nervous, feeling tired all the time, feelings of loneliness. Postpartum depression may make it difficult for you to take care of your baby and handle your own daily chores. Rarely, postpartum symptoms can become more severe and include hallucinations, difficulty understanding what is going on around you, and attempts to hurt yourself or your baby. This is rare and is called postpartum psychosis. The symptoms of postpartum psychosis usually show up in the first 2 weeks after childbirth and are a medical emergency. Risk factors and screening. Postpartum depression can happen after any new birth. Even if you have had children previously and experienced no postpartum depression symptoms, you could still be at risk. Certain factors can put you at a higher risk for getting postpartum depression. You are at an increased risk for getting postpartum depression if you have a history of depression, even if it was just during your pregnancy. You had postpartum depression after giving birth to a previous child. You have or your family has a history of premenstrual dysphoric disorder, which is also called PMDD for short. You are also more likely than others to have postpartum depression if you are having problems with your partner, your pregnancy was not planned, you have a small support group of family and friends. In the past year, you have had a lot of stressful events or large changes in your life happen. If you are worried that you have or may get postpartum depression, talk to your doctor. There are simple tests that can help your doctor evaluate you for postpartum depression. The Edinburgh Postnatal Depression Scale, or EDPS for short, is a simple 10-question screening test that can help your doctor find out if you have or are more likely to have postpartum depression. There are many risk factors that could increase your likelihood of getting postpartum depression. Make sure to talk with your doctor about your risks for postpartum depression.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Diagnosis. If you have been feeling symptoms such as anxiety, depression, panic, and insomnia for more than 2 weeks, you may have postpartum depression. Postpartum depression does not mean that you are a bad mother. It is a serious and treatable medical condition. If you think you may have postpartum depression, talk with your doctor right away. Your doctor will talk to you and may ask you to fill out the EDPS questionnaire or another screening test like it. The EDPS asks questions about how you are feeling, your sleeping patterns, and your thoughts. Some other medical problems could cause depression similar to postpartum depression. Your doctor may take blood samples to rule out other possible problems, such as thyroid disorders. Why you should ask for help. Some women feel embarrassed about their symptoms. Postpartum depression is not a sign of weakness or a character flaw. For some women, it is a common part of having a new baby. Even if you feel embarrassed or nervous about talking to a doctor, it is very important to seek treatment if you are experiencing postpartum depression symptoms. The information you share with your doctor is confidential. Remember that your doctor is there to help. Without treatment, postpartum depression could get worse and last longer. In some cases, untreated postpartum depression can last a whole year. If you don't get treatment for your postpartum depression, it could turn into a chronic problem. Not treating postpartum depression can have a devastating impact on you and your family. Postpartum depression can get in the way of the normal bonding process between a mother and her child. Untreated postpartum depression can cause strain in your personal relationships, including marital problems, which can make the symptoms even worse. Children who had problems bonding with their mothers while they were babies may act out when they get older. They may have behavioral problems and slow language development. Treatment and coping. If you have postpartum depression, there are helpful treatments available. Which treatments are right for you depend a lot on your symptoms and how severe they are. Your doctor may prescribe antidepressant medications or hormone therapy to help even out your hormone levels. Talking about how you are feeling with a psychiatrist may also be helpful. Counseling can help you work out ways to cope with the symptoms, solve problems, and make healthy, realistic plans. Group counseling may also be helpful. Many mothers find it is helpful to talk to other new mothers who are also suffering from postpartum depression about personal experiences. Having support from people who understand what you are feeling can be very helpful. You can also do some things at home to help cope with and even reduce the severity of some of the symptoms of postpartum depression. Here are some tips. Eat healthy. Make sure to eat a lot of healthy fruits and vegetables. Get enough sleep. Try and get enough sleep. If your baby is sleeping, try sleeping too. If you can't sleep, try and lie down and rest. Stay active. Make sure to stay active and keep moving. Light exercise can help stabilize your mood. Always talk to your doctor first before starting an exercise plan. Stay in touch. Make sure to talk to your friends and family. Avoid isolating yourself. Don't be afraid to rely on your social support group. You may find treatments like acupuncture, massage therapy, and art therapy helpful as well.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Conclusion. Postpartum depression is a combination of physical and emotional changes that happen to mothers after giving birth. If you have been feeling symptoms such as anxiety, depression, panic, and insomnia for more than 2 weeks, you may have postpartum depression. Postpartum depression does not mean that you are a bad mother. It is a serious and treatable medical condition. If you think you may have postpartum depression, talk with your doctor right away. Your doctor may ask you to fill out a sheet called the Edinburgh Postnatal Depression Scale, or EDPS for short. The EDPS is a simple and short questionnaire that can help your doctor evaluate you for postpartum depression. Your doctor may also order blood tests and do a general physical exam. Postpartum depression is a serious condition that, if left untreated, can lead to long-term depression, trouble bonding with your new baby, and family problems. Fortunately, postpartum depression is treatable, and there are ways to help cope with the symptoms. Treatments include medications and counseling. There are also several simple things you can do at home to help cope with the symptoms, including eating healthy, getting sleep when possible, exercising, and staying connected to your friends and family. If you are suffering from postpartum depression symptoms, do not wait to call your doctor. With treatment, you and your new baby can look forward to a more enjoyable time together.
Thank you for using Explain.